Welcome to Doctors on Call. I'm Jenna Miller. In the medical profession, activities related to ensuring access to care, navigating the system, mobilizing resources, addressing health inequities, influencing health policy, and creating system change are known as health advocacy. Health advocates support patients on their journey in many ways, including encouraging a healthy lifestyle. Healthy eating is one of the best things you can do to prevent and control health problems such as heart disease, high blood pressure, type 2 diabetes, and some types of cancer. Your heart, your brain, your entire body benefits from exercise. More than 70 million adults in the U.S. are obese and 99 million are overweight. The good news is that you can take steps to lose weight, and losing even some weight can make a big difference to your health and how you feel. You may not have to lose as much as you might think in order to start seeing health benefits. Health advocacy and living a healthy lifestyle is our topic tonight on Doctors on Call with our guest, Dr. Dustin Moffitt.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from CAMCO, the state's only Kansas-based medical liability provider, serving medical professionals and advocating for the health for all Kansans.
Russell Regional Hospital, experts, neighbors, friends.
Your family is our family. Staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in North Central Kansas.
Dr. Dustin Moffitt received his bachelor's degree in chemistry from Wichita State University and his doctor of naturopathic medicine from the National College of Natural Medicine in Portland, Oregon. He is a member of the American Association of Naturopathic Physicians, the Oregon Association of Naturopathic Practitioners, and the Western Pain Society. Dr. Moffitt is the vice president of the Kansas Naturopathic Doctors Association. He is also part of the Medical and Science Advisory Board for Zycle Bioceuticals. Doctors on Call brings you information which may be useful to you when you see your own physician. Thank you so much for joining us again, Dr. Moffitt. It's great to have you back.
Thanks for having me back.
Absolutely. First of all, let's jump right in and let's talk about why healthcare advocacy is so important.
So becoming an advocate for your own health is extremely important in this day and age to make sure that you're keeping on top of your own health goals and making sure that your healthcare provider is following along and listening to those goals so that you can continue to move forward.
So give us an example of what health advocacy is.
Well, as a naturopathic doc, a lot of times I will see patients come in stating that their provider wants to put them on these medications and they place them on more medications to sustain the first ones, right? There's nothing wrong with medications and there's a time and place for each of those medications. But there's also sometimes a time and place to look at retracting some of those and moving them in a more natural direction. As life changes, right? There's a big stress event that causes something new to come on. You're placed on an antidepressant or an anxiolytic to help with that, but now your lifestyles have changed. You've eliminated some of those stress causers. So instead of continuing on that medication, maybe we'll look at a more natural approach to reduce some of that with some kind of a natural anxiolytic that would be a category called a nervine, right? So that would be an advocate for your health to start moving forward in that direction. Other ways could be, let's say that your cholesterol was high, right? And you were put on a statin medication, but maybe you wanted to look at seeing, that was several years ago when you were started on the statin, but now you've started a diet and lifestyle exercise routine. You have changed eating out to now cooking at home. That would be an advocate to now move forward to try to assess to get off of that statin. Usually when people want to get off of statins, I will say, let's do a 3-month trial period where we try to introduce these specific dietary routines or maybe these specific nutrients or like a natural statin supplement or something to help to reduce your cholesterol. And then we monitor once a month for 3 months and see what kind of impact that's made and see if that's an advocate to get them off.
Sure. Is it safe for a patient, let's say they're feeling great, to take themselves off a medication? How do you feel about that?
Generally, I do not recommend that because you don't know if there's going to be withdrawals or if it's going to come back and cause some kind of a storm. medication guidance through some kind of a doctor or somebody that knows what they're doing with that medication management is going to be the best. It's not good to just cold turkey quit. Let's say that you are on an exuberant amount. So I deal with a lot of thyroid medication. Let's say that you're on a quite high thyroid medication and you try to just cold turkey quit. Your body is going to suddenly miss all of that thyroid hormone, and you might see a massive reflux the other way and not be able to recover as easily if you were to transition or taper off through medical guidance.
Okay, good advice. What are some of the responsibilities of a health advocate?
The responsibilities is to make sure that you're heard. So when you're in the doctor's office, if they continually talk down to you or say that they're going to fire you if you're not listening, that's where you want to step up and be an advocate. Don't be rude to the doc. A lot of times they're just trying to find standard of care guidelines to follow. But you can become an advocate and state that it's my admiration to move this way. Are you going to be there to assist me through this, or do I need to find another practitioner? Oftentimes, if you're reasonable with that practitioner, you'll be able to come up with a new treatment plan, and maybe they'll work conjunctively with somebody else that also will help you through that journey.
Is there a difference between being a health advocate and informed consent? Is there a relationship with those two?
Informed consent really boils down to knowing the pros and cons of each situation. So for back to the cholesterol medication, so statins, there are pros that can drastically drop it. Now the cons that often aren't relayed is the hormonal decline that'll go with that. Remember that cholesterol is a steroid, right? Steroids are what make our sex hormones. The cholesterol also helps our cell walls bind together and create their cell wall barriers. So if we're constantly knocking down cholesterol too much, we're going to see the recoil from that opposite way. Or we've also seen that cholesterol medications can reduce cholesterol so much that then we see a decline in vitamin D status. And we all know that vitamin D, the lower it is, the more health consequences that have been shown, right? It's very protective in chronic illness states.
Interesting. Okay, so let's talk about some of the different types of healthcare advocacy, starting with medical care. Medical care, let's go in then into medical billing.
Oh man, billing would be outside of my realm there, but when it comes to medical care and advocacy, really it's going to be standing up for what you know is right. So part of the advocacy we're going for is advancement of naturopathic doctors, right? We're increasing scope, or trying to. That would be an advocate on my side, but on the patient's side, reaching out to your local senator or something and going for that. Advocacy, so looking forward to nutritionists or going into yoga classes or some kind of a personal trainer, seeking a broad spectrum of healthcare to identify your causes, right? So if you have chronic back pain, it doesn't mean that you need to be necessarily put on opioids, right? You can go to chiropractors, you can go to physical therapists, you can go to personal training, yoga, massage therapists. All those are advocates for your health, all pertaining to low back pain, right?
Excellent. Okay. What about navigation of older adults?
Navigation of older adults when it comes to advocacy. That becomes a little bit more difficult when Medicare comes into place. But their standard of care is a lot more persistent, and it's hard to veer from that. So a lot of times as we age, if you are looking to become a true advocate for your health and step up for more natural stuff, a lot of times you're going to end up paying out of pocket. We have to remember that healthcare is more about sick care management than it is truly about preventative care.
Absolutely. Now, how do you become a healthcare advocate? Is there a way?
You just have to stick to it. You have to do your research, right? Anybody that educates themselves, now obviously Dr. Google can lead us down a weird path, right? But educating yourself about your current stance, let's say that you have diabetes. Go on the internet, look about, what are lifestyle things that you can move forward, and that will tell you, okay, where do I need to seek guidance? I know that I need to eat better, but I don't know how, right? So that would be becoming your own advocate, is you've expanded your knowledge just a little bit to know where next to look. And if you don't know where to look, ask your friends and family. A lot of times they'll know providers that they've seen help with this condition, and this was their solution.
Excellent. Okay. Can you explain what are clinical markers for health and preventative screening?
So typical screening lab tests would be CBC, CMP, lipid panel. That's going to look at your white and red blood cells, look at your blood sugar, look at your kidney, liver function, and some electrolyte markers. Cholesterol obviously is going to look at every which way. There's ones that you can go above and beyond that. So vitamin D status could be something we'd look at, or micronutrient, which would include all of the vitamins and minerals. Looking at hormone and thyroid function, because our thyroid balances our way that we produce energy, and it helps us with our thermogenesis. Our hormones help balance as we see aging adults. What do we often see aging adults struggle with? Weight gain, depression, or muscle loss, or just putting on fat weight, right? So looking at different laboratory assessments would be a way to move that. And then there's also more specific at looking at toxicity studies and et cetera.
Excellent. Okay, we're going to remind our viewers that we are talking about health advocacy along with a healthy lifestyle tonight with a naturopathic doctor, Dr. Dustin Moffitt. Give us a call. Our number is open, 800-337-4788 if you have a question. You have mentioned depression a couple of times. I think right now we're in a time in history where that's kind of at an all-time high. What's some ways that you might help treat a patient?
Well, some of the tried and true that do not require a doctor is get sunshine and don't wear sunglasses. We know that blue light on the back of the retina actually stimulates the parts of the brain that help instill happiness. Okay, body's movement, exercise is incredibly important, and exercise does not have to be vigorous. Just gentle walking at a distance that is far enough than what you had done the day before, right? So every move in the right direction is perfect. Sleep. Not enough people are concentrating on sleep. Research time and time again shows that 7 to 8 hours of consistent sleep. It doesn't have to be in one sleep cycle. As we age, some people move to a binaural sleep cycle where they need to sleep twice a day or something in smaller doses. But other ways that we can combat that depression is look into providers that can assist with more natural things. Eating a healthier diet, believe it or not, goes a long way. Sugar feels great. It makes you feel super happy right away. But what do we often get after that sugar high? We get a crash, right? So we're seeking that dopamine from that sugar release, but then right after we get that high dopamine, we get a low crash. And that's where we can see worsening of depression. Or alcohol consumption, right? It feels good right away, but long term it actually has been shown to link to worsening depression.
Now, are there any kinds of vitamins or supplementation that you find patients who are depressed are lacking in, besides the vitamin D?
Vitamin D is definitely one. Vitamin C is great at helping our body recharge a lot of pathways. Magnesium helps us deal with some of the stress hormones that we see. B6 and zinc as well kind of go along with magnesium to help our body break down pyrols, which are anxiety-inducing metabolic breakdown products. Other nutrients I typically move towards more botanicals, so like lavender, chamomile, St. John's wort. These are ones that you can utilize to help. Like I said, they're nervines, which means it's directed towards nervous pathways.
You've mentioned healthy eating a few times. What is your approach to healthy eating?
I try to keep it pretty basic to get started. So I always state that if you are moving 80% of your diet towards a whole food nutrition, which means it comes from whole foods, ideally not from packages, and most of the whole foods products are on the outsides of the store, right? So you've got your produce section, your dairy, your meat, and then your breads, right? So all of that, if you're eating 80% of that diet and moving that direction, you're doing wonderful. If you're still only at 20%, try for 30% next week. Small steps make the largest momentum. It doesn't have to be cold turkey. If that's what's for you to just go straight to it, great. But most of us don't have that kind of willpower. I know I sure don't. I still love a burger and fries or something else, but it's all in moderation. And it doesn't have to be just eliminate everything that you're doing that would be considered a bad food, right? Give yourself the treat and just know that if you're having the burger and fries, maybe the next few days, let's try to be a little bit more health conscious with some of our decisions and make sure that each of our meals are as nutrient dense as possible. So think about each meal you're making and say, how can I make this more nutrient dense?
How do you feel? We hear a lot about the ketogenic diet in the last several years. How do you feel about a keto diet?
A keto diet, when done correctly, is very well. Believe it or not, actually, ketogenic diet is heavily based on plant foods, right? So when we're looking at vegetables and fruits, we can actually still enter into a ketotic state. It's not meant to be just bacon and eggs, right, or cheese. It's meant to be heavy protein, so a good protein source with good healthy fats in certain proportions, and everyone's proportion is going to be different. And then you look at the rest of it and look at, okay, what are ways to lower my glycemic index with these? So meaning lower carbohydrate persistent foods.
And there are a lot of, diets that are, the food comes to your home. How do you feel about that?
It makes life a little bit easier. You just have to make sure that the portion sizes aren't too large, and that they're very well balanced. Believe it or not, they're actually keto through the mail order places available nowadays. I've tried a few of them. I will say that some of the food was great, but their portion sizes were kind of large, and it could definitely lead to weight gain if you're not watching it. But let's say that you just found a way that, you need 500 calories per meal, per se, right? When we go out to eat, most meals at restaurants are 900 to 1200 calories. So if you're going out to eat, split it in half. Same goes for if you're doing those mail ordered. If it looks too big, go ahead and cut some of it off and save it for the lunch the next day.
Sure. And how do you know if you're getting the right amount of vitamins and nutrients in your food?
The only way to know is to assess, so to test, because otherwise it's just best guesstimate. Now you can do well. The way that you are setting yourself up for it is eat with the color of the rainbow, right? Try to get some of colors of different food sources that would be plant, so meaning veggies or fruits. And then don't eat the same things over and over again, because remember, each food has its own food nutritional profile. So we want to make sure that we're getting as much nutrient diversity as possible.
Okay, we hear also about the BMI, the body mass index. What are the guidelines for that?
I'm not a big fan of BMI past children. It becomes kind of an irregular number. So as an adult ages, yes, it can be a guidance system, but do not put a lot of weight on it. If you want to look at your waist to hip ratio size or something else, BMI is kind of outdated technology beyond children, and it kind of puts a lot of people at a hindered state. Just because you have a 31 BMI doesn't mean that you're grotesquely obese or anything. It doesn't take into effect how much muscle mass somebody has. That's the discernment with BMI, is just looking at your height and your weight, and that's pretty much it.
Okay. Now let's talk about health risks of obesity. Besides heart disease, what are some other risks for being obese?
Increased cancer risk, increased hormone and thyroid dysregulation. There's a lot of them. Just because a person is obese or has extra weight does not mean that they are necessarily unhealthy in every way, shape, or form. There is such a thing as health at every size. Does that mean that if you've got extra weight that you couldn't do much more to improve? Absolutely. There is plenty more. There's plenty more that I could do to improve health within my own life. I look at extra body weight as a guidance system as well. So I will ask the patient, okay, what are your goals? Are you prepared for the next step? Are you wanting to lose weight? And if they say no, I don't push it other than say, okay, well, your cholesterol is extremely high and your liver enzymes are elevated. We probably need to talk about some kind of a modification to move those the right direction. And with that, a lot of times weight loss is a byproduct of correcting that kind of thing. Doesn't mean we have to make that a primary goal, but it can become a secondary goal. And that's where a lot of your health advocates would stand up for you, is to say that weight is not everything. Now, weight is important, but it most certainly is not everything.
Excellent. How much does weight have on, how much impact does weight have on, let's say, heartburn?
Some increased adiposity around the central section does push more intrathecal pressure, meaning it's pushing that stomach upwards, which can make that reflux a little bit greater. So weight loss would reduce some of that. To what extent, I don't know, because I can tell you that there are plenty of smaller individuals that still struggle with GERD. A lot of times we can look into food allergies that would be an underlying agent, or small intestinal bacterial overgrowth, or some kind of a gut dysbiosis, meaning the bacteria are out of balance.
And how do you test for food allergies?
So there are two main types. I like to call it food allergies and food sensitivities. So we actually can assess IgE mediated, which is allergy. It's a true allergy. There's IgG mediated, which is a type of allergic response that is more of a gut response, and we call that a food sensitivity because they can actually shift throughout our life. Then there's also IgA, which is more of a salivary response. Insurance coverage, yet again, that sick care is IgE mediated. But there's actually research to show that IgG has an anaphylaxis type response, so that choking response as well. Insurance just has not gotten back to it. So they're about usually 10 to 20 years behind where research is.
Okay, we're going to go to the phone lines. We've got Sarah on the line from Palco. Hi, Sarah. Go ahead with your question for our guest, Dr. Moffitt, tonight.
Yeah, I was wondering, what are some indicators that I should see a doctor now for my health instead of doing it on my own?
Chronically fatigued, not sleeping well, hair loss, mood dysregulation, chronic bowel issues, food sensitivities, meaning that you are gaining weight without knowing why, yet you're eating a healthy diet. Sometimes that food is rebelling at you because your body doesn't know how to appropriate it. Some other symptoms would just be depression. I mean, it can go a long way too. We kind of spoke about that, and with the way the economy is, that would be something we want to try to stay on top of rather than have to go the other way. There are plenty of clinical markers to look at. It really depends on what that specific person's goals are to try to move forward, but surely, a consult with somebody that is there to be your advocate. They can help guide you in which direction may be best suited for you.
Okay. Thank you for the phone call, Sarah. You had mentioned the food allergy test. I know there are some at-home tests that, how accurate might those be?
Their accuracy has gotten better. Depending on which companies you're using would really kind of substantiate that. Actually, one of the ones that we use in our office, you can still get a finger stick approach. And they've actually done their own clinical assessment because they do serum and finger stick. And they're within a half percentage point of accuracy to each other. So they've gotten better. I still do prefer serum, so an actual blood draw rather than a finger stick. But same thing, if that's the advocate for your health to move in the right direction because you've assessed what foods are irritating you, that's okay. Some information is better than no information. And like I said, when it came to food sensitivities, they can shift. So just because you had one done 5 years ago doesn't mean that 5 years is going to translate to where it is today. So rechecking them if you're still having chronic GI symptoms is good.
Sure. And if a patient or a person is, ready to make a change, but they just don't know where to start, what's your advice to that person?
Ask your friends. Ask your friends what their experience is and see if they've had any help and guidance in that. That would probably be best because word of mouth is always the best referral source, right? Finding somebody that you can relate to with that problem would be another one. And then, like I said, use the internet to your advantage. There's so much information out there. Now, sometimes it's a little overwhelming, and if it is, then just find your local provider. And if you've got a naturopathic doc near you or somebody that is a functional medicine doc or integrative doc, those would probably be where I would steer you to.
And what about maybe a place to start as far as exercise goes?
Go for a walk. That would be the best bet. Go for a walk, make that a daily routine to where you just get some intentional movement out. Then when you're ready, maybe start a little bit of a yoga routine or start some weight-resisted band treatments. But if you're still lost, personal trainers are out there, right? They can teach you routines and make sure you advocate for your health. Tell them you don't want to just go gung-ho on it, start low and slow.
Sure. Okay, thank you so much. Our thanks goes out to Dr. Moffitt for being our guest on this week's Doctors on Call. Be sure to tune in next week where we'll be discussing heart disease. You can email us questions for our next program at doctors@shptv.org. Thanks for joining us. For Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from CAMCO, the state's only Kansas-based medical liability provider, serving medical professionals and advocating for the health for all Kansans.
Russell Regional Hospital. Experts, neighbors, friends.
Your family is our family. Staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.